Hi, welcome back to another episode of the Healing Medicine Show. I'm your host, Blair T. Lemire of Pharmapreneur Academy. The vision for this show is to provide healthcare professionals with resources and inspiration for both personal and professional development practices, especially those that are rooted in the holistic health model. We really believe that the change we want to see in healthcare starts by focusing on the health and the healing of the healthcare providers. I am very excited to announce our 2024 Women's Wellness Retreat scheduled in beautiful Costa Rica. We will be meeting there February 3rd through the 10th, 2024. If you're interested for joining us for this wellness retreat, a week in paradise, you can check out the comments below or go to pharmapreneuracademy.com for more information. On today's Healing Medicine Show, we're going to be talking a little bit more about medical misinformation. So Coach Amanda Romine-Nelson is here with us. She's a pharmacist. She also consults on health, wellness, and lifestyle medicine. She conducted a widespread campaign called Stop the Spread during the pandemic, where she worked with the Department of Health and also did COVID tracing. She spoke with over 10,000 people who were positive for COVID in 6 months. She's also credentialed. She did a 2-year postdoc residency in medication safety, quality, and informatics. She is a very smart lady, and we are so excited to have her with us here today. Thank you for being here with us, Amanda.
Thank you, Blair, for this opportunity and just letting me be on the show and talk with you about what I've been experiencing and gone through. So I appreciate this opportunity.
Absolutely. So we're going to kind of dig into your story. We're going to talk more about medical misinformation. We've all experienced it firsthand. Now we've all kind of lived through a global pandemic together. That was very interesting. So part of the Healing Medicine Show is really talking about our own personal stories. But I want to start off this interview the way I start off all these interviews, which is by asking you, what does healing medicine even mean to you?
And that's a great question. I love how you do start that off, because it is interesting how we're all a little bit different on how we would see really healing medicine. So for me, I would say it's really understanding and getting to the root cause of what is going on. So for an example, if we were to have a headache, yourself or myself, and we're thinking, okay, there's something we can do, which is we could easily take a medication like a Tylenol or an aspirin. But really, when it comes to the root of what's going on in the body, is the body saying, oh, that's what I'm looking for. I'm needing some acetaminophen or I'm needing some salicylic acid. More than likely, that is not the chance and what is actually happening in the body that's saying, I've got a headache for a specific reason. So it's really getting to that root cause of what is going on to really get your body to heal itself. So you don't have to think, is it necessarily medication to take? Now, I get why we take medication occasionally and sometimes, and it could be to quickly get rid of a symptom that might be sitting there, but it's really most likely putting a Band-Aid on something that is not actually getting to that root cause. So healing medicine to me is really going for that root cause of why our body is showing us a symptom or giving us a signal that something is off. It's not in line, it's not balanced. And whether that starts with the neurological system and then works its way down, and then you have your gut, you've got the gut-brain axis and all the parts that go together. So recognizing that everything's connected and it's telling us something. So getting to the root cause, that would be it for me.
Yeah, and I totally agree. Whenever I work in the pharmacy, when people come in and ask, what do you recommend for a headache? I'm going to ask, well, how dehydrated are you? What types of vitamins do you take? How much stress are you under? And those are the things that have helped me more than anything. The meditation, the yoga, the drinking, never letting my water bottle get further than arm's reach away from me. And I think that people don't really understand that about pharmacists, is because we know so much about medication safety. We have a reverence for medications, and there's a time and a place, of course, for them. But if we can get the offending agent out of the way or do something that is non-pharmacological to intervene, that's going to be our drug of choice, is to remove the offending agent or, add something that the body is really craving, not, it's not a lack of acetaminophen in the body, as you mentioned. So I want to ask a little bit, how did your own personal journey kind of influence your now professional journey? It sounds like there's really been this paradigm shift. And I know pharmacy school, we were really taught to be the medication experts. So how did you come to lifestyle medicine and lifestyle modification? What was your own personal experience like that brought you here?
Yes, and that's a great question. And I think in the beginning or in general, it's like I was definitely more raised on the holistic approach. And so just even
Okay.
starting off in the world of pharmacy, I was that way. And I know that even when I was in pharmacy school, I was focused on complementary and alternative medicine. But that was just, a slight part of what we we're learning, which is to become the drug expert, right? So then when I was doing the postdoctorate work and getting now into working my job, and then I had an opportunity. I was precepting students, listening to their story, what it is that, what got them into the world of healthcare. And we all have like a story or a reason why, and we're thinking, how can we make the best impacts? So now the pandemic hits, COVID happens. And when I got that opportunity to talk to, and I say it was an opportunity because at the time it was very stressful. And now I look back and I'm thinking, wow, it helped create the whole story. But I talked to almost 10,000 people who are positive for COVID in a 16-month time frame. And what I kept hearing over and over was there's these concerns, these questions that were coming up that were almost getting put into like buckets or trends, that it seemed like we were failing people being in the world of healthcare to just answer some of the most simple concerns and questions that they have. And I'm like thinking, how do we overlook just letting people know, like, what's the right vitamins to take when they're not feeling well, how to make sure you're getting the right supplementation. Even just something as simple as, I don't know if I'm drinking enough water or staying hydrated. And I thought, oh no, how did this happen? Because when you go into the healthcare system, you're thinking, I'm going to have all these tools and this knowledge and information. I'm going to share it with people, and they're going to be able to feel empowered and know how to really take care of themselves. And now I'm talking with them in the midst and the height of this pandemic, and they are very stressed. And they're thinking, okay, what do I do to make sure I don't turn into, unfortunately, like one of those numbers that we're seeing where people are not getting, living past the pandemic, and they're at their heightened worst kind of thinking in fear, like what's going to happen. And they're hearing a healthcare person and they're thinking, please tell me, what can I do? And I'm wanting to make sure that I'm providing them the right resources, that it's just something they can do at home, not if they're not able to get into the hospital because they don't want to go to the hospital or can't talk to their doctor because the doctor's really busy, the tools that they can have to know not to get confused with Dr. Google, because I know a lot of them would like to look into that or pay attention to the news, but hear what they can do for themselves. So that let me realize right there on a baseline level, there's something more I can do to make an impact that's just looking at what we have around us and not so focused on the healthcare system and the information that's coming out of it. So that's really what I think started to help me start hearing and thinking that there's got to be some differences in what I can do to make a better impact.
Yeah, I do remember during the pandemic, and I was working from home as a consultant. So I was not actually in the pharmacy setting during that time. I was pregnant during that time.
Cool.
A whole nother traumatic story. But I remember a lot of people asking from my own family, what can I do to boost my natural immunity? And they had no idea. People were asking about zinc, and they were asking about vitamin D. And, you know, I applied to pharmacy school. I remember in my essay writing about wanting to study medicinal herbs and novel drug development in the Amazon rainforest. So I too have always kind of had this more natural, I guess, leaning propensity for medicine. And I would tell my family members, you can take these supplements, but really the best way to boost your natural immunity is exercise, it's sunlight, it's um, whole foods. It's very much dietary related. Drink enough water. You know, the things that the modern healthcare system kind of leaves out. And so I think as as my pandemic story kind of evolved, it really was built around what are the healthy things that I can add into my life to boost that natural immunity.
Exactly. And sometimes they get overlooked because people are just thinking, is there something quick that I can take, or just in a sense prescribe, or what's the doctor saying that just is going to help me get past, in a sense, like this hump, and not going, okay, what can I do for a lifestyle modification or change while I'm dealing with a current basically positive test, for lack of better words, when it came to just focusing on COVID. So that really I kept hearing again these trends, just something as simple like you just said, of the whole food nutrition, and then like, that was missing. And so I'm talking with almost 10,000 people who are positive for COVID, but then I'm sitting there watching my fellow healthcare professionals, in a sense, crashing and burning, and being like, this isn't what we got into healthcare for. This is, I mean, I can't do this much more. And I could see that we were losing really good healthcare professionals because they were just burnt out. They were frustrated. They're like, I feel like I'm failing the patients, let alone my own family and then myself. And so I thought, again, there's an opportunity to even help the healthcare professionals just be healthy as well. So that's when I was thinking, I have another option that can sit there, but still dealing with the pandemic and all the reactions and reactory propensity that we were doing, which is not a lot of proactiveness. It was seriously a lot of reactiveness that was happening. Got me in kind of my own little spiral too. So I'm talking to all these people and I'm getting locked jaw, my eyes twitching. I'm not getting hardly any sleep. I'm working 7 days a week, and I'm thinking, I can't keep this up forever either. And how can I start to help myself too? So through this journey of listening to people, trying to do the best I can to help them, realizing that I'm not making the impact that I was hoping to make, then I got presented with the question that came to a lot of those healthcare professionals who are working in a hospital system or in a pharmacy, or depending on wherever they are at. But as the vaccine was coming out now, it was, okay, well, do we have all the healthcare professionals take the vaccine, and what the concerns are there? Now, I was quite busy, and I was hearing people who were vaccinated, people who were not vaccinated. I'm talking to everybody and hearing the spectrum from these calls. So when it was my turn to be said at my current hospital system where I was at, that, okay, so we're mandating that people take the vaccine now in order to keep their jobs. I now am thinking, I've got to look into this for myself a little bit more, because as much as I'm hearing everybody else talking about still catching it with taking a vaccine, I just need to do a little bit more research. My background, definitely having that 2-year postdoctorate program in medication safety, quality, and informatics. Even my undergrad was very much highly on the research side too, with chemical engineering, bioengineering. It's like I was aware that I needed to just do my own due diligence now. So I asked the question, can I just see the package insert in the informed consent? And from the extra training I had, definitely I knew to ask certain questions and maybe look at the VAERS system, because I had spent time in it doing the postdoctorate work. And when they told me there's no informed consent and no package insert, that was really unsettling to me. And I thought, okay, this is not something, this goes against what I've even spent extra time, effort, and energy to look into in my own training. So when they said they cannot provide that because it doesn't really exist, I did get to see a package insert that came with, I cannot remember which vaccine it was for sure, but all 3 of them had it the same way, which was a whole package insert that has the words intentionally left blank on it. I said, I don't feel comfortable taking this. And I said, is there any other options that we can do? And when I was told, no, this is the way that the system has decided, you take it. Or to get an actual type of exemption, you'd have to choose a religious exemption. And I couldn't, in my own integrity mind, say the reason why was because of a religious reason, because I did not see that being a necessarily reason here. It was because of my own understanding and education of why I was making that decision. So my own integrity did not let me fill that out. So they said, okay, you're going to get suspended, and then you need to make a decision within 2 weeks. And I decided I don't feel comfortable taking it. So I did get fired from the traditional healthcare system in that setup of how I was. So that was interesting.
Absolutely. And, thank you for sharing your story because I think that there's a lot of healthcare providers that went through that during the pandemic. And I think it says a lot about someone that is so highly trained to still make that decision because the evidence wasn't there, and in pharmacy school, we're all about evidence-based medicine. And, if you look at the reasons why complementary and alternative medicine isn't accepted, it's because there's no evidence. And yet here we have this new vaccine when there's not a lot of evidence there either. So what are some practical tips? Because this show really is about helping healthcare providers make those decisions for themselves. What are some practical tips you have for people to help them kind of wade through the misinformation that is out there, that we're just overwhelmed with the amount of, what Dr. Google tells us. And now we've got AI joining the mix and technology. So how do you see healthcare moving forward in a way that leverages technology, but also leverages our own critical thinking skills to kind of bridge the gaps where this medical misinformation may be coming up?
Right. And I think this is definitely an evolving world. And an answer I might give today might end up even changing, as you mentioned, because of the AI and how it might learn from us differently. So the best way I can say, speaking from myself, and then obviously kind of if I were to say, thinking about all those 10,000 people I talked to who maybe don't have their background or education in healthcare, is to first and foremost, like, there is something to say about knowing your own personal boundary on what you feel you're comfortable with or not, because at the end of the day, and we tell patients this, we tell clients that it's like, we only know that however information you give us or tell us, we're able to give a good recommendation for. So as much as what you have going on, because you know your body. So if you know your body and what's going on with it, in order for us to help you as a healthcare professional, it's like we need you to tell us what's going on. So I would say the first thing is just trust your own body and your own boundaries and your own instincts. So come from that angle first, knowing that there's going to be information you're going to look into. But at the same time, figure out who you know as far as a healthcare person or professional that you can trust, because either they've shown that they care about you, to know that you're your own individual too. You're not just kind of blanket statement, okay, I tell everybody this, so I'm going to tell you this. It's like there's got to be some kind of understanding or a rapport that's built from that side of things from a healthcare person. But now if you're just like, I don't talk to anybody, I don't have anyone who I can at least feel I have that trust and understanding, then when you're going for information, and just trying to look it up, I think it's fair to obviously start with, the main governmental ones that are sitting there, like your NIH, all of those, but then at least try to find 3, because some people will just, I read it one place and I'm taking it for kind of, gospel truth because you read it on one area. Or it's like, look for your trends, look for multiple sources saying, in a sense, the same information. But it's one thing to say, okay, if you think about mainstream and everybody was saying the same story, and then they would hear these like one-offs, which unfortunately gets the name of the whole conspiracy theory, or gets the name of not maybe a vetted information, then I think take it to somebody and say, here's what I keep hearing and understanding, but I want to just get your thoughts on it, like, and then hear what somebody else has to say, opposed to working in a silo. Because what I thought kept happening, unfortunately, is because people in this pandemic situation were kind of kept more in their own silos or with their own people, because they weren't able to talk with other individuals of what's going on, because people were kind of holding on to their own fear. We lost that whole community opportunity that sits there too. So knowing that we're dealing with AI, knowing that we're dealing with a lot of misinformation that can be put out there, is don't hold yourself in a silo, and be willing to have that conversation, even if it is uncomfortable, with somebody else, because at the bottom line, it's still your health. It's still, nobody knows your body like you do. And if there's something that makes you say, I have to question this, instead of just thinking, let me go along to get along, it's no, at the end of the day, it's still you. So don't forsake certain things that you've known that your education or background or your own personal experiences have told you works or doesn't work. that would probably be like overarching what I would say that I kept hearing and learning from people, that was what was almost keeping them in a sense of fear. And then from a healthcare professional, I think it's still, and that's what I keep saying, don't forsake, as you're even saying too, we know about evidence-based medicine, but don't forsake that sometimes if the evidence is sitting there of this is like where we're at as a new place, like how can we forget in a sense how hypotheses work? And that's what I feel like kind of happened. It's like we've got this null hypothesis and then you've got the other one, the alternate hypothesis, and it's like until one is proven either way, it's like then you go back and you reevaluate. It's like I felt like for a while we forgot some of those baselines of science, so now let's go reevaluate the new information. It was almost like, no, we're going to continue on with the plan even if the plan is showing us, or our results are now showing us, it's not the same as what we initially thought. So just take that step back. I mean, that's just something I think we get to do as humans, which is very nice, is we get to an opportunity to just kind of remove ourselves for a second, take a step back and critically think, okay, now that I see what I have here, what has changed, and then make a decision going forward, opposed to continuing on with a plan that could be still failing and falling apart. So that would be what I would say we need to do.
Yeah. One thing you said there that I really want to highlight is the personal values and boundaries piece of it. Excuse me. I'm struggling through my own illness right now. So this idea of personal values and boundaries is something that I think, in the past, it's very much been like, just do what the doctor orders. And what I'm seeing in healthcare is much more of a patient-led model where I've gone through the health coach training and it was absolutely fantastic. What I loved the most about it was that it empowered patients to set their own health goals. So, their health goals is not having a headache, every single day or one day a week or whatever. It's not their health goals isn't necessarily to stay adherent to their medicine or to get their A1C under 7 or whatever. So asking the patients who are the experts on their body, and I'm talking about this from my own point of view as well. When I started really paying attention to how my body was sensitive to certain drugs or certain, caffeines or certain toxic people or, thoughts or whatever, that was a much more empowering place to be, because when you know your body and you have the time and the space to notice, oh, that food doesn't like me very much. Let's remove that food, even though it tastes super yummy. Let's remove that food, see if it helps with the bloating. And you can become an expert on your body by listening to that biofeedback. But it does take some time to slow down. Something that I started doing that was really helpful to me was creating a food journal. I also, I also tested myself. So I got the nutrigenomics test and I found out that I was positive for the MTHFR variant. So just knowing these little things about myself, oh, it's not that big of a deal. I just have to take methylated vitamins. But knowing those small things, it gave me more and more confidence that I am the expert on my body. And if something feels off, that I can very quickly notice that, oh, that didn't agree with me. Or yesterday I started a Medrol dose pack. And so like instantly my face started flushing and I started feeling hot and so like when I react to medicines, I notice that very much because I know what my baseline is. And that comes from the meditation, the yoga, the being very careful about my foods and what I put into my body, because I've developed a lot of sensitivity because we're trying to remove as much as the, inflammation, or the foods or whatever that's causing inflammation in the body. So whether that's a vaccine or whether that's a medication or a food, I think it's important for you to be very aware. And for me, self-awareness has been the best medicine and when I work with people, I think that's the number one thing that I try to impart upon, my clients and patients is become aware of your your habits, whether they're good or bad. If you eat pancakes from McDonald's every single day, become aware of that and become aware that there is a price to that, and that your body is paying that price. And could you substitute, for something different? Could you substitute your, sweet tea for something else? So I think, you know, from a healthcare professional standpoint, we want to say you should do this, you should do that, but really from a health coaching standpoint, it puts that it puts those values back in the hands of the person and say, what do you really value? If you don't want to give up your daily pancakes, that's fine. But just realize that there's a trade-off. Well, what will you be giving up instead based on your health goals? So I think that your story will definitely inspire a lot of people. And I want to say I was just so impressed by your conscientiousness and your courage to do something, to go against the grain. And because you had such experience and such background, is very interesting to me. So I just really hold you I hold a lot of respect for you, Amanda. When people kind of start on this journey, there's a big learning curve. So how do you help people? How do you work with people? And where can people find more information about working with you?
Yes, and thank you so much, Blair. I appreciate you. Just saying, you're right. It did take a lot of courage. It was to go against the grain, or at least be willing to kind of question the science when everyone was saying just to trust it. And I mean, again, my undergrad is in engineering, and then I went and got into the pharmacy world, and I understand and I love science, but there's something about science that we all should know, which is you can trust it, but you should have an opportunity to verify it. And that's all I was trying to do. And it led me to where I am now, which I am thankful for this journey that I am on. And basically, when I start off with somebody, just to, like, if they find me or they're thinking, maybe they want to work with me or not, it's just starting off with really a discovery type of a call, just a complimentary consultation to see what it is that I can do to help them, where they're at on their own health and wellness journey. And is this something that they want to do, is start working with a coach, or possibly they just have certain questions that they need to do a consultation on, because I had done so much different research on how to answer those questions that came up from the trends and the buckets that I kept hearing people's concerns falling into. I spent some time just really putting together a portfolio of different things that I would recommend or endorse to answer some of those questions. So someone might come to me from just that angle of things, and I want to make sure I can provide them what they're looking for from that side, to just be healthy, to live their best life, and really feel empowered when they do have conversations with the doctors, or from that side of things. So, but really, when it comes to a passion that I have, and I have it in two ways, I will say it, but I'll say I'm a pharmacist passionate about helping people to decrease their meds to live healthy and thrive. And I'll also say I am really focused on helping you to be your best so you can give your best. And that can mean a healthcare professional who's giving their best, or a professional who doesn't work in healthcare, or an individual. It's like, if we are truly at our best, that is the best. That's the only way we can truly give our best in whatever it is that we're doing, to come from not just a full cup, but almost like a cup that's overflowing, to where you're able to continuously give out and still have what you need. So it starts with, someone might find my information on askcoachamanda.com is the website that I have, askcoachamanda.com. And on that website, it can say, are you an individual looking to really get closer, or really realize your health and wellness goals? Or are you a healthcare professional who might be tired, burnt out, and frustrated, and just looking for ways to really get healthier, invest back in yourself, get that game plan? And so I kind of have two tracks going on, and I really just want to always have that first conversation with someone and see where they're at, to see how I can, if we're a good fit, help them to really bridge and close that gap. So they have, that excitement to know that they have really that game plan that really can help reduce that frustration or those roadblocks or barriers that were causing them not to get where they wanted to be on their own personal health, wellness, and life goals. So that would be the main way, is askcoachamanda.com. And then from there, it might take them to another website. If they're a healthcare professional, Dr. Romine-Nelson.com is one that I focus a lot with my clients who are in the healthcare industry.
Yeah. Awesome. Thank you. I will link those, your website and everything below so that people can contact you. I love that you said be your best and give your best. So that is definitely something that we are trying with the Healing Medicine Show, with the Healing Medicine Retreats, helping healthcare professionals go on their own healing journeys so that when they come back, when they work with patients, they have more tools in their toolbox because they've been through it, they've experienced it, they understand what healing is about. Healing isn't necessarily about putting people on more medications. I love that you said helping people decrease their medications. To me, that's what true healing is. It's not depending on medications. So Amanda, thank you so much for joining us here on the Healing Medicine Show. And thank you so much for what you're doing. I really appreciate learning more about you, and we will give you your link to your website so that people can